Hello and welcome to this episode of DMC's Medical Matters. Today we are talking about joint replacements with DMC orthopedic surgeon Dr. Christopher Cooke from DMC Huron Valley-Sinai Hospital. Welcome, Dr. Cooke.
Thank you very much.
You know, typically when we think about joint replacements, we think about maybe somebody who's older, 60s or 70s, but that's not the case anymore, is it?
No, it's not the case. Most of the time when people are in need of a joint replacement, regardless of their age, we know what can improve their quality of life and the activities they do. So at this point, age is just a number, and we depend more on the patient's symptoms, their pathology, and their x-rays, whether or not to offer them a joint replacement.
What are some of the advancements that have been made in joint replacement surgeries?
Some of the advancements in the most recent years include the materials used for total joint replacements and the techniques we use to do them. As far as the materials are concerned, the metals and the plastics we use inside the body can now last 25 years after surgery. And with the techniques, we now utilize robotic-assisted total joint replacements. This allows us to increase the accuracy of the implant, and this includes less time in the operative room, less bleeding, decreased time for a patient to recover, and less pain overall.
What are people's biggest fears or misconceptions about having joint replacement?
I think a lot of people equate joint replacement to being old and not able to do certain activities anymore. And within reason, the opposite is true. We want people to be active. We want them to exercise. We want them to see family, to travel, to work. And the majority of activities are possible and even encouraged after joint replacement surgery. So instead of it possibly ending a chapter of someone's life, the way some patients might feel like, it might reopen certain activities that they gave up due to the pain in the past.
Well, it sounds like joint replacement can really change a person's quality of life. So what are some of the comments or feedback that you get from your patients after surgery?
If you pick the appropriate patient, and between having the right surgery and the right rehabilitation afterward, people really do comment on the decreased pain they feel during activity and at night after activity. Things that they may wanted to avoid in the past, going up and down stairs, going for walks with their family, even things like golfing or traveling, they at that point get back into, they rediscover their life for it. And most patients tell me after they've recovered, whether it be 6 or 12 weeks, they wish they would have done the procedure sooner had they known the outcome they would have gotten.
That's great. Well, I know you're an orthopedic surgeon, but surgery is not always your first choice when treating someone with joint pain, is it?
That's correct. The majority of patients who see me who are candidates for joint replacement don't go to surgery the first time we see them. We have a lot of really great non-operative treatments which can decrease pain, let them get back to activities non-operatively, and prolong the life of their own joints before they might possibly need a joint replacement someday. Whether it's physical therapy to strengthen the muscles, medications to decrease inflammation, bracing to give them more stability, we can help patients as they go on their own journey to continue doing the activities they want to do while the body's natural progression of arthritis occurs.
And why is it important that somebody shouldn't delay care if they have joint pain?
You shouldn't delay care. Most people are afraid to see a surgeon because they think it means surgery automatically. But when you have joint pain, one, it may not be arthritis that's causing it. There might be another cause that can be treated or fixed operatively or non-operatively. So just because you see a surgeon, what we don't do is surgery right away. We evaluate you. We talk with you. We do a physical exam, we take x-rays. Based on our discussion, we try to come up with a non-operative treatment to treat you. And sometimes we're able to discover the reasons for the pain and get patients back to activity and able to encourage them to be more active, because having joint pain can cause a person to decrease their activity. And that can cause other health problems, both physically and mentally. So just being evaluated can help a patient at least understand what's going on in their own body and try to improve their situation.
Well, all great information, Dr. Cooke. Thank you so much. And if you would like to make an appointment with a DMC orthopedic surgeon, please call us at 1-888-DMC-2500. Or for more information on joint pain, visit dmc.org/ortho.